An unknown illness has killed over 50 people in northwestern Congo in 6 weeks. That's according to doctors on the ground and the World Health Organization's Africa office. A hospital medical director there told the Associated Press that's what's really worrying is that in the majority of cases, the interval between the onset of symptoms and death has been just 48 hours. The outbreak began January 21st, and there have been 4,109 cases, including 53 deaths. According to the World Health Organization's Africa office, the first outbreak started after 3 children reportedly ate a dead bat. They died 2 days after developing a group of illnesses characterized by fever, bleeding, headache, joint pain, and other symptoms. Earlier, we were joined by Dr. Abhishek Raut, medical director at Appletree Medical Group, to discuss why information about the deaths have been made public just now.
Well, I think that's an excellent question. And I think the delay in making this information public, we can look at different factors for that. I think firstly, we're looking at a very rapid onset and progression of the illness, many symptoms appearing and leading to death within 48 hours. So it makes it very challenging for local health authorities to really identify and respond quickly. Also, we're looking at a remote location of affected areas in northwestern Congo. We're seeing villages of Boloko and Bomate likely contributed to all of those delays as well in communication and reporting. And what we do see, though, is there have been quite a few initial efforts made to identify the cause of that illness as well. And that involves extensive testing for hemorrhagic fever diseases like Ebola, dengue, Marburg, and yellow fever. All of those take a lot of time to process as well, and it requires samples to be sent to the National Institute for Biomedical Research in Kinshasa. So all of that, with the complexity of the situation, likely contributed to that delay in publicizing.
And with the onset of symptoms and death being just 48 hours, many are wondering how serious this illness is and what numbers will have to be reached for the World Health Organization to declare this as an emergency.
The concern here is it is very serious, with symptoms leading to death within 48 hours. We're seeing a very high fatality rate, and the speed on which it affects individuals is a significant concern. Right now, we've seen 419 recorded cases and 53 deaths. It's complex on how the WHO makes that decision. Typically, to declare an event as a public health emergency of international concern, we have certain criteria that need to be met as well. Really, the decision involves the severity of the public health impact. Does the illness pose a significant risk to human health? There's the risk of international spread. So the disease must have a potential to spread beyond the borders of the affected country. And certainly a need for a coordinated international response. Those are the three big criteria that is used. Now, in this case, with the rapid onset and the high fatality rate, combined with the potential of that disease to spread, it is something that I'm sure the WHO is going to be closely monitoring to see if it makes that declaration.
This mysterious illness is just part of a larger trend of viruses jumping from animals to humans. In fact, in areas where wild animals are eaten, these types of viruses are up by 60% since 2022. We asked Dr. Raut on why there is a spike.
So I do note that we do see a significant increase in these zoonotic diseases there. Certainly, I know that the WHO is actively monitoring it, but we are seeing potential reasons on why this is happening. So first of all, the complexity of zoonotic diseases is quite various, where you have to look at coordination between human, animal, and the environment. So the WHO has what we call the One Health approach that works in collaboration between human health, animal health, and environmental health to really look at preventing and controlling zoonotic diseases. Secondly, I think we're seeing a large and rapid urbanization and population growth in certain parts of Africa, which in any case will lead to significant human-animal interactions. And so what we will see is those interactions can be derived from, of course, actual meeting of human and animal, but also the demand of food delivered from animals, meat, poultry, eggs, and milk. And so certainly we increase that risk for zoonotic pathogens to spread. And then finally, we see a lack of resources and infrastructure in some areas, and that can pose a significant challenge because you need those resources for effective surveillance, early detection, and rapid response. So what we do see is there's complexities involved in this, and I know the WHO is likely actively working to address that, but zoonotic diseases do cause a lot of complexity, and it's always difficult to respond very quickly to that.
Some have speculated that it's possible that this mysterious virus is a new strand of malaria.
So what we do know about malaria, specifically in that region, is it's very strongly endemic. The Democratic Republic of Congo had about 27 million malaria infections and about 24,000 deaths of the disease in 2022. So in this particular outbreak, some samples have tested positive for malaria, which does suggest that malaria could be a contributing factor. But what we are seeing, though, is the rapid onset, a high fatality rate, and symptoms like fever, vomiting, diarrhea, nosebleeds, and fatigue implies more that there may be other factors here at play. And it certainly is possible that this outbreak involves a very severe form of malaria, but certainly there are other factors we would look at first, see if that is playing a greater role here.
And with the COVID-19 pandemic now behind us and more attention being paid to the spread of new viruses, we asked Dr. Raut about the concern for this becoming another pandemic.
I think it's understandable. We all have that initial reaction when we see news like this, whether this is going to lead to another pandemic state. And certainly with COVID-19 in the back of our minds, always there are concerns of that. But looking at COVID-19, there are some factors you've got to consider. Now, the pandemic, which was caused by the SARS-CoV-2 virus, had very unique combination of characteristics that contributed to this rapid global spread. They had a very high transmission rate. They had asymptomatic carriers and the ability to spread through respiratory droplets. So that's a very dangerous combination. You can see how very quickly that could spread throughout. In the case of the current outbreak there in the Democratic Republic of Congo, the illness has shown now a rapid onset, high fatality rate, and symptoms leading to death very quickly within 48 hours. But the transmission dynamics and the exact cause of the illness are still really being investigated. And this preliminary analysis at least suggests that the outbreak may be linked more to the consumption of bat meat, but we don't know specifically what the pathogen is that has been identified. So it's important to monitor the situation there, but there are very key differences here between this outbreak and COVID-19. And I do think that overall we should be cautious, but I don't expect that we are going to lead to another pandemic.